Welcome to Get Naked with Dr. Kate. I'm Dr. Kate Balestrieri, a licensed psychologist and certified sex therapist. But mostly, I'm someone who believes the conversations we avoid are the conversations that can set us free. I founded the practice Modern Intimacy, where my team and I help people make sense of the invisible forces driving their desire, their relationships, and their emotional health. This podcast is for people ready to have a more honest relationship with themselves and everyone else. Because knowledge isn't just power, it's pleasure. So here's your invitation to peel back the layers, to get smarter, to get closer, and to get naked. No pressure, no performance, just the real thing. Today with me, I have Dr. Nicole McNichols. We've been longtime social media friends,
Yes.
and I've been following all of the great work that you do at the University of Washington. You really are an inspiration as a professor. I wish that I would have had a professor like you in undergrad.
Thank you, Dr. K. I am so excited to be here, and that's so kind. Thank you.
You've been working at the University of Washington now for how long?
I have been there for, I've been teaching for about 15 years now.
Amazing.
Yeah, it's been a minute.
Wow.
Mm-hmm.
And you have a course that is called The Diversity of Human Sexuality, which, if I read correctly, draws about 4,000 students annually.
Yes, it does. It's the largest class in the history of the university, which is kind of wild.
It really is. Wow.
Yeah.
And did you start the course there?
No, I actually inherited it from
Okay.
a professor who had taught it for about 30 years before me. It was large when I inherited it. It was about 300 students a quarter, and then I brought it in and expanded it. And it just has grown over time as demand has grown and grown and grown. There's still a wait list to get into it, but I try to get as many students in as possible just because I feel like everyone has so much curiosity and need for this topic, and I just want to be able to help as many of them as I possibly can.
And I'm so glad you're doing that. I mean, we both know as sex professionals that the quality of sex education across the country really varies depending on the
Yes.
school district, the state, the city. It's really spotty, and it's hard for a lot of young people to get good quality information about sex ed. So when they get to college, that's usually their first entry point. And
Yes.
what a gift that they get to have your class. I mean,
Thank
I've seen you
you.
bring in Dan Savage, adult content creators, other guest professors. I mean, you're just really bringing in
Thank
a
you.
well-rounded list of people for them to learn from.
Yeah, and I've also been lucky because I've found that people who are educators and thought leaders in this field, I feel like we all it's a very supportive community, I feel, because we kind of all recognize that there's so much misinformation out there, so much stigma, and we kind of all feel passionate about trying to give students and give people the information that everyone really needs. And so, I've been really lucky to get, some really incredible guests in who've been willing to share their expertise and their perspectives. And I know my students have been incredibly grateful for that too.
And they're probably the most savvy students on sex now that exist. So for those of you listening, if you're not familiar with Dr. Nicole, you can check her out on TikTok and Instagram at Nicole_the sex professor.
Yes.
She's got a mad following. It's great. And
Thank you.
your content is really fun.
Thank you. I have a lot of fun making it.
I can see that.
It's a nice creative outlet for us academics.
It is. It is. And you've got a new book out.
I do. You could be
Yes.
having better sex.
You could be having better sex. We all
Yes.
could be having better
Right?
sex. Yeah.
Exactly.
So walk me through what prompted you to read this, or write this, excuse me.
Yeah, so I just felt like, when I look at the transformation in my students, that having information about bodies and sexual mindfulness and communication techniques, and even understanding things like kink or BDSM, or, understanding the dynamics of sexuality, when I can see the transformation and positivity that brought into their lives, and then looking outward at the incredible hunger I think there is for information like this, I wanted to be able to create a book that could help people the way I've been able to help my students, that really kind of presents research-backed, evidence-based, comprehensive, sex-positive information in a way that's really engaging and fun to read, and that really is written for anyone, no matter who they are, what they're into, what their vibe is, where they are in their sexual journey. Because like you said, I think all of us could be having better sex.
All of us could be having better sex. Which brings me to a listener question. So I want to read this. This gentleman wrote in and he said, Dr. Kate, I've been listening to your show for a while and I feel bad writing this question because nothing's really wrong. My wife and I have great sex, often enough. I can't complain, really, especially when I hear my friends talk about how little sex they're having with their wives or how my wife's friends talk about the terrible sex they're having. My thing is, I think my wife and I could be having more sex or different sex or better sex, even though I'm satisfied. I'm not even sure what better sex means, but I think a lot about the sex that I'm missing out on potentially, and I don't know how to bring it up, right? If it's not broke,
Right.
don't fix it. So do you have any ideas?
I do have ideas. And one of the things I talk about in my book is this idea of micro-novelty, right? I mean, we all know that switching it up it's literally the spice of life, right?
It is. God
It
love
keeps things
dopamine.
interesting. We love our dopamine. And novelty is the key to keeping dopamine levels high. But it can feel overwhelming, right? I mean, I think a lot of people think of novelty as meaning, oh, I've got to go to the sex store and get like this dominatrix outfit and come out home with like the whips and chains. But the reality is there really are small things that you can do that feel like maybe they're pushing you out of your comfort zone just a tiny bit, right? Without feeling like you're trying to become a completely different person, right?
Mm-hmm.
And so maybe it is using a slightly different sex toy or trying a position and, putting a pillow underneath your partner's butt to increase the chance of the, stimulation of the clitoris or whatever it is that you're sort of looking to do. So, I mean, like looking at places where you can introduce novelty to actually increase pleasure and to increase the chance that it's feeling really good for everyone involved, that can be one avenue. But a lot of times, another way to introduce novelty into a person's sex life is just to be sort of introducing other types of intellectual or aesthetic or future-oriented intimacy overall. Yeah, I mean, sexual intimacy is not the only type of intimacy that exists. And sometimes we need to work on things outside the bedroom before we're able to experience that sense of connection that leads to great sex inside the bedroom.
I'm so glad you brought that up. This is one of the things I wrote down in reading your book that I wanted to talk to you about because a lot of folks think about intimacy as just sex, or
Yes.
sometimes they might broaden that definition to include emotional intimacy. But there are so many different dimensions of intimacy, and you mentioned a couple that don't get talked about a lot, especially the aesthetic and the future-oriented intimacy. And intellectual intimacy, I've only heard a few other people talk about that. So let's break these
Yes.
down a little bit.
Yeah, absolutely.
Yeah.
So let's start with the intellectual intimacy, right? I
Yeah.
mean, if you think about it, we all have different ideas or worldviews or interests or passions, right? It might be that you've started a new job, a new hobby, or maybe there's a cause that you've gotten really involved in, or different ideas that you're thinking about, a new book you read. It's limitless. And the idea is that by sharing with your partner sort of these new ideas that you're thinking about, that introduces a feeling of connection, right? And I think one of the biggest aphrodisiacs in a relationship, especially a long-term relationship, is feeling really seen.
Yes.
Right? Feeling really bad. And when somebody hears your thoughts on a particular topic and really looks at you and is clearly listening and is genuinely interested in what you're actually saying, has those active listening skills, is asking follow-up questions, and seems interested, that's going to create a sense of intimacy, right? There are some people where this type of intellectual intimacy is so profound that they even identify with it. They call themselves sapiosexual, right?
Guilty.
Guilty too. Exactly. It can be so central
Yeah.
to sexual intimacy for some people that it literally is almost like a sexual orientation, right?
Completely.
Yeah.
But I do think it really speaks to that attunement and a few things related to the micro-novelty that you were speaking to
Yes.
earlier. When you're learning new things or you're talking about something that maybe you are just discovering, your partner also, if you're partnered, gets to hear about those things for the first time and gets to see you with a different kind of sparkle, a different kind of glimmer. And if they are truly curious about you and they are invested in understanding the dynamic layers that evolve within you, that kind of attunement is often really...
That's hot.
It's so hot. It's erotic. It is the best way to convey to someone, wow, I see you. I'm interested. I want to learn. And that's an adventure.
It truly is. Same thing with spiritual intimacy.
Yes.
Right? Like people hear about spiritual intimacy and they immediately think, oh, spirituality or religiosity. Sure, yes, it absolutely can be. But it can also just be a sense of almost a shared worldview. It could be values that you share that you believe in. It could be things that you feel are just really just important to you, the core of who you are, and being able to talk about those things with a partner and again, have them see that in you and get lit up by that and lean in and hear your bid for connection through the expression of an interest, you know, in that kind of spiritual domain. That's a big turn on, right? People don't realize that that builds intimacy. And same thing with aesthetic intimacy, right? Just another idea I talk about in my book, which can be this idea of, you know, a shared experience, like enjoying a really elegant meal together, or taking in a beautiful painting, or a gorgeous sunset. This is often why vacation sex can be so hot, right?
I mean, vacation sex is hot for so many reasons.
So many reasons.
Yeah. But it's true, right? You're experiencing this thing together, and that is maybe new, or maybe it's deeper than your everyday life. Maybe it's rich in details or nuance. And so again, there's this shared journey of investigation.
Exactly. And then, you know, another area where this shows up that may not be obvious, but that I would categorize as aesthetic intimacy is admiration for things that you've created together, including your children, right? Right? I mean, and that might be sort of a shared sense of spiritual intimacy, but I mean, really, you know, I was just at a gymnastics meet, you know, with my daughter and husband a couple of weeks ago. And yes, of course, there are aspects of sitting through any sports event where you're watching your child that can invite drudgery. But also, you know, as we're watching her do all these backflips and something she's worked so hard on, and there's a sense of pride in that and awe in that, right? And so whether it's that or, you know, like for us, it's the family we've created, but it could also be like a business you've started or a cause you've both given time to, or aspects in which you've both given back to your community. I mean, again, that overlaps through this aesthetic and intellectual and spiritual types of intimacy. And that is going to translate back into the bedroom, because back to your original point, sex does not operate in this distinct dimension that's separate from the rest of our very being. It's integrated really into everything.
If we allow it to be, right? A lot of folks spend time keeping it very separate because of shame and fear and a lot of negative scripts they've inherited over the years. But I do think moving into this idea that the erotic is an integration, it's an activation, it's a vitality, that creates the room for there to be a lot of nuance, novelty, curiosity, and that's the spark.
Exactly. That is the spark.
So I heard our listener question maybe just a little differently, and I want to offer another thought around it.
Well, I know, because I don't feel like we quite answered it actually yet. You're right.
I mean, we brought so many ideas to for this couple to explore. But what I heard is maybe a curiosity about permission. Do I get to want more, even if what I'm experiencing is good enough? And I don't even know what good enough means, right? For each person, that's different. But I think this question of, can I want more? Can I want something different? Or am I saying something negative about the eroticism or intimacy that I do have? And I think that might be kind of at the core of what's being asked here.
I think so too. And this is one of those fascinating examples in life where there are multiple truths.
Absolutely.
There are multiple truths here, right? Because on the one hand, you are allowed to feel like you are enough, right? And there's even something within the sexuality research called the good enough sex model, which shows that you do not need to be having sex swinging from the chandeliers and doing backflips from crazy positions in order to be satisfied. And that as long as it is satisfying and regular, couples report pretty high levels of sexual satisfaction and relationship satisfaction. So let's hold space for that. But at the same time, yes, absolutely, you have permission to explore and want to up-level your sex life. And I think that really begins in a conversation with your partner, because I think that we're really afraid to talk to our partners about this because it's such a vulnerable topic. And, you know, anytime we're saying we want to improve something in our relationship, it kind of comes with this inherent fear that what you're saying is that what you already have isn't good enough. Right. Even when you know it is. Yeah.
And I think it's also, it's so protective that he wants to be so delicate and really introduce this with the respect for how good their intimacy is together. I really want to acknowledge that. But I want to bring us to something that you mentioned in your book. You developed a hierarchy of sexual needs. And I thought this was so smart.
Thank
and
you.
I wonder if we can break it down a little bit, because I also think it might speak to what this listener is sort of yearning for. So in the spirit of maybe Maslow's hierarchy of needs, is that where you got this?
That's exactly. Yes,
Yeah,
exactly.
Okay. So you imagine this triangle, and at the base of it are physical and psychological sexual needs.
Yes.
The middle tier is the social and emotional sexual needs.
Yep.
And then at the pinnacle, at the top, are creative and self-expressive sexual needs.
Yes.
And so I imagine this listener is maybe tapping a little bit into that top part.
They are,
Yeah.
exactly.
But let's back up a little and go into this pyramid and
Perfect.
kind of talk through it. So walk us through the base.
So I built this pyramid because so many people want to be having better sex, but don't know where to start. And sort of the answer to that question often depends on the place from which you're coming. And so, yes, absolutely, that caller definitely is coming from a place where they want to, you know, they understand their body. They perhaps feel like they have communication needs that or communication skills that are adequate, but they're looking to add that sort of third top level of curiosity, right? And so what that's going to look like for that person is, you know, maybe realizing, okay, I'm splitting the difference here between needing to address my social and emotional needs, because he needs to be able to speak to his partner, to communicate what he's looking for in a positive way that doesn't leave his partner at all feeling rejected or fearful, but instead feeling like this is a fun journey to be along. Exactly. Right? And so, you know, in that, it's sort of this idea that you need to be able to have scripts available to you to communicate, you know, and use as a launching point that are sort of building off of this idea of, well, how do we figure out these other things that we might want to try? And then getting into that third level, which is, you know, looking at your fantasies, looking at maybe underlying slight desires for kink or bondage, if that's something that you're interested in, or role play, or even if it's just sexting or dirty talk or whatever it is that you're up for, right? But, you know, the hierarchy is, you know, it's going from the cognitive and the physical, which is looking at understanding your body, understanding what touch feels good to you, to the cognitive, which is this idea of carving out your mental erotic space, which often means achieving a sense of sexual mindfulness that comes from getting rid of shame and stigma and stress and exhaustion. And that once you have kind of gone through that foundational level, what you've done is you've sort of, in essence, kind of turned yourself on. And I mean that in sort of a more psychological sense. Like you're able to show up to your experience as present, because so often, I think, especially in couples' sex lives, when sex starts to dwindle, we think there's a problem with the relationship or with our partner, but oftentimes it's just that we've sort of lost attraction to ourselves. And it kind of comes back to peeling away, you know, what's going on for me? Am I exhausted? Am I stressed out? Am I carrying a cognitive load or guilt or, shame from having grown up with a lot of sex negative language that's getting in my way. And then getting into the place where you're, comfortable with, having sort of the social emotional level where you have the conversation starters to be able to talk to a partner about how you get your sex life sort of, up a level and in a more creative space, and then progressing through that. So the hierarchy I think is just helpful for people who kind of want a roadmap, right? Because a lot of times we just don't know where to start and we don't really know what the route is to get there. And so I felt like it was just sort of something helpful to lay out for people.
Yeah, I loved it. It was so orienting. And what really stood out to me is at the top of the hierarchy here, creative and sexual or self-expressive sexual needs. It feels so similar to self-actualization.
Yes.
And so I do think that for a lot of people, when their sexual safety needs are met, when they understand their anatomy, they know the basics or even the more complex ways of how to get themselves and or their partner off, they don't have those hang-ups. There is maybe this upper echelon of self-discovery that can happen through sexuality that sometimes isn't available through other means.
Yes.
And I think we talk about this a lot when we talk about fantasies. And in clinical work, I'm frequently talking with clients and patients about their curiosities. What do my fantasies mean about me? And I'll say, let's take a step back for a second. Instead of thinking about what the fantasies mean about you, why don't we explore what the fantasies allow you to feel?
Yes, I love that. Exactly.
And either emotionally or physically. And then we can maybe mine what does that mean for you or about what is missing in your life or what you want more of in your life.
Right.
Because the fantasy is kind of a metaphor. It's a vehicle to get you there. It doesn't mean anything about you.
Exactly. I mean, and that's why all of this, right, really can be a metaphor for establishing these skills in the rest of our lives.
Yes.
Right? I mean, if we can learn to be led with curiosity and experimentation and adventure in our sex lives, that's going to empower us to be able to demonstrate those abilities in the rest of our life too. And so, I mean, I think becoming self-actualized as a sexual being, a sexual person, it doesn't mean that you're doing the most extreme things. It means that you're the most in touch with those feelings that you want to feel during sex.
Absolutely.
Yeah.
And it does foster a lot of room for generalizability, like you said, into other areas of life. And sometimes sex is one of the only places where we can really play with the themes in a safe way with a trusted partner or with ourselves.
Exactly.
Yeah. So, dear listener, thank you for writing in that question. I hope we touched on some answers that give you a path forward. I wanted to talk with you a little bit about how to address when people are in a longer-term partnership and one partner is really enthusiastic about increasing their knowledge sexually or getting them out of a sexual rut they might be stuck in, and the other partner is kind of hitting a wall.
Right.
Or exhibiting some kind of mismatched effort. In fact, Amanda Monte and Tracy Clark Flory on their podcast Dire Straits talked about recently, I think they coined this term, the fifth shift.
Yes.
Have you heard of this?
I haven't. Tell me about it.
So the fifth shift is it's an evolution from the first shift, which talks about when women go to work, they work their 9 to 5. The second shift in heterosexual relationships, they often come home and they have all of these domestic child care duties.
Yes.
The third shift is tending to sexuality with their husband if they're married or with a partner if they're not, and really making sure that his sexual needs get met, hopefully their own in there somewhere too. And then another researcher whose name is escaping me now coined the term the other third shift, where she talks about the emotional labor that many women are tasked with, where they have to perform that it was great sex, tolerate pain during sex. What were the other two things?
Fake orgasms.
Fake orgasms. And then also describe the sex as satisfying because it was satisfying to their partner and not necessarily to them. So there's a lot going on there in terms of the emotional labor of sex. But the fifth shift talks about taking on the responsibility and the mental load of improving their sex life when it gets stuck or when something happens and their partner's unwilling to meet them in that effort. Now, it's not only women who do that in heterosexual dynamics. People of all genders, sexual orientations can run into this kind of mismatch, but it does happen in a disproportionate way in heterosexual relationships. So I wanted to bring up this question of, what do you do?
Right.
What do you do?
Exactly. And I think that's, I mean, it's just so poignant, right? Because the reality, first of all, is that women tend to lose their level of sexual desire more quickly over the course of long-term relationships than men. And the reason for that probably is because so many women are having sex that's not necessarily pleasurable for them.
Absolutely.
Right? And it's kind of like, we are seeing all of these scripts in the media and porn about what sex should look like. We assume it means there's a little bit of kissing, and then it kind of is penetration, and then he has an orgasm, and then it's over.
And she miraculously had a great time.
Right. And she somehow miraculously loved it. Exactly. Right? Whereas, only 18% of women can, have an orgasm that way. So a lot of it is, yet at the same time, women have been taught to be the nurturers, right? To take on the emotional labor, to take on the care of everybody else's feelings. And because of that, there can be sort of a lack of entitlement, which is really a necessary ingredient.
Yes, a healthy entitlement is so key.
Yes, it is so key. Exactly. And, so what do we have? We have an epidemic of women who are faking orgasms,
We do.
which I think is what you described as that third shift or fourth shift.
The other third shift. Yeah.
The other third shift, which is pretending it was amazing, which is its own form of self-abandonment, really. I mean, you might in the moment think that it's just easier, you're saving your partner, hurt feelings, but you're really, that kind of deception, you're really not allowing yourself to, again, going back to this pyramid, show up authentically when you're pretending that something was that fabulous when in fact it just left you feeling kind of used. I mean, really, if you're only having sex and only one person is really enjoying it, you're going to feel a little bit, for lack of a better, sorry for the imagery, but a little bit like a masturbatory sleeve at that point.
What I
right?
say all the time. Yeah.
So don't treat yourself that way. And it might feel like it goes against everything you've been taught, especially if you're a woman, in terms of making everything easy, taking care of the emotional needs of people around you. But ultimately, you owe it to yourself to be able to speak up in the relationship, to say, hey, and it doesn't have to be something where you're giving criticism. It could be something where, you're focusing, you have to do the homework too of figuring out what feels good to you and what you might want to try, which might be the type of work you've never done before and might feel, might go against sort of the image that you have of what it means to be, a good girl or a good woman in today's society. But if you can kind of recognize whatever that shame or holdup is and put it on the side and really say, okay, what feels good to me? What are these fantasies telling me about the emotional state that I want to feel during sex? And if you can go to your partner and simply say something like, I love you and I love sexually connecting with you, but I want to make our sex life even better, right? I want to be able to do things that are going to feel really good for me, and I have some ideas, right? You're coming to it with a much more sort of positive framework that's going to help you have better sex rather than coming to it where you're just focused on the negative and what's not happening. Because reality is that if you've never told your partner that you're not satisfied, right? If you've never been honest about the fact, if you have been faking orgasms for a long time, you haven't really given your partner a chance to see that and, to understand that actually, there's more that could be happening that would feel better for you and that would allow for a more authentic connection during sex.
I'm really glad you said that. I think it's a tricky situation, especially if there is any coercion or other instances where safety maybe is in question and a woman feels like she needs to really protect herself or protect the mood of the home. I think in those instances, I trust people are doing what they need to do to keep themselves safe and keep the situation contained. But barring any of that in the room, right?
Yeah.
A lot of men that I work with, and I've been working with men for 20 years in this space, and women too, people of all genders, but the men that I work with who come in often feel super betrayed.
Yes.
When their partner 5 years, 10 years, sometimes 20 or 30 years down the road says, I've been faking my orgasms with you.
Yeah.
And I get it.
It is a betrayal. It's absolute betrayal. And you have to kind of own that a little bit, right?
Yeah.
Because yes, it's good to be, obviously, you need to be having that conversation, and it's critical that you be opening the door to this conversation. But you really have to also own the fact that for whatever reason, right, you felt like you couldn't speak up, and that might be due to just ideas that you had about sex that made it feel normal, that it was not pleasurable, or worse, that it was painful. But that is going to be experienced as a betrayal. It is a form of deception. It's pretending that you're enjoying and being almost a certain version of yourself that is, in their eyes, going to a little bit feel like a lie at that point.
Yeah.
And so there's just, I think to kind of be able to sort of diffuse the anger or the hurt feelings that could come in a situation like that, I think both partners just have to work really hard to have a sense of compassion for each other and what it must be like to be in the other person's place.
That's exactly right. I mean, I really understand the betrayal that is felt, and also when we look at the systems that we live in and the ways that so many women have been conditioned to abandon themselves sexually in order for their social systems to maintain intact and to feel like they are being the quote-unquote good girl that they've been prescribed to be. There's a lot going on there, and I think, if you're a man listening and you're like, wow, yeah, that really lands. I felt super betrayed when I learned that about my partner. Go ahead and feel that.
Yes.
Talk to your therapist about it. And also, maybe you can hold some space for the fact that she's probably never really been able to give herself permission, and she's been lying to herself too, about what she needs, what she's okay with. And the why probably isn't about you, but even if it is, there's a lot of growth there that can happen when you both do approach that reality.
There's so much growth that can come from that, right? I mean, just to even just take the step forward to be acknowledging that this is happening in the relationship. And really, one of the things I write about in my book is really leaning into this sexual growth mindset, right? Which is really leaning into this idea that, it can change, it can get better.
Yes.
You just have to be willing to experiment. Sometimes we need to be able to have bad sex before we can have great sex to learn what it is that we want or don't want, right?
And sometimes the bad sex reminds us of how good the
great sex really is.
But let's come back to this question of what do you do if you're the only person in a relationship who's trying to pull this train forward?
Yes.
Your partner has their heels in the ground. They're stuck. Maybe it's shame. Maybe it's whatever. We don't know. But they can't meet you in the effort to step into that self-growth space together.
Yes.
Or maybe you're in a casual context and you don't have that kind of trust or intimacy with another person built yet. So maybe you're in there like, I'm in my growth mindset. And the other partner's like, what? You want me to get an STI test? What does that mean? Right. So how do you maybe sit with that mismatch of effort or readiness?
I think you have to find out really what's going on underneath it, right? And I think it requires asking the again, framing this positively, leading with curiosity, but just saying something like, I really sense that like, I am so into this and our sex life is great. I'd love to make it better, but I kind of sense like a little bit of hesitancy from you, and I would love to know, do you like, am I reading that right? Do you feel hesitant? Right? And then kind of get them to give the answer. Well, why do you feel hesitant? Where do you maybe think that comes from? Right? How do you, when you think about our sex life, right, there's always things that can be better or that could be expanded upon, right? How does it make you feel to even talk about those things or acknowledge that that could be happening, because it's just depending. I just would be, I would be leading from curiosity, right? Because I think that that's going to kind of, do two things. First of all, not come across as being critical and rejecting, which is immediately going to shut the person down. But it's also going to cause the person to kind of look inward and become more aware of what is it that's keeping me from wanting to move forward. Now, it might have absolutely nothing to do with the partner that's more motivated to move things forward. It could have to do with stress, with exhaustion, with, different, maybe underlying relationship issues or small resentments that haven't been addressed or spoken about openly, right? It could also be that one partner just simply has more responsive desire. And that's okay. There usually is almost always one partner that has more responsive desire than the other person.
Well, of course, because you're not always the same.
Exactly. You're not, sexual desire discrepancy should, be considered a feature, not a bug.
Absolutely.
And so, and if that's the case, sort of talking through, well, then, what helps you to feel in the mood? Like, what ways can I initiate? Or, are there ways that we could have you initiate that would make us both feel excited? I just feel like question asking, I just think back to, this really famous study by Arthur Aaron, the 36 Questions to Fall in Love.
Oh, yeah,
just,
I love those questions.
Yeah, and just the profound ability for question asking to not only lead to understanding, but really encourage vulnerable sharing, which is essentially what builds that level of intimacy. And so, you might be tempted to get angry, be frustrated, but again, I think if we can just be leading with that sense of curiosity, we can kind of figure out what's going on underneath it.
I think that's right. And I also have worked with so many couples over the years where that's where it starts.
Yeah.
And then things don't change, or they're met with defensiveness or shut down. There are many instances where curiosity can start the conversation, but they often bump into these roadblocks that seem to go nowhere.
Yeah.
And I think that's really painful.
It's
it can
really
feel
painful.
So lonely for the person who wants to connect. And it feels really lonely for the person who's shutting down.
Yep.
They may or may not have insight into, why am I shutting down? Why don't I do want to have sex with my partner. Why can't I get there? It can be really confusing.
It can be really confusing. Yeah.
I think in moments like that, it's a good opportunity to maybe do some individual therapy and kind of get that ball rolling.
1,000,000%. Exactly. I cannot overestimate the power of therapy. I mean, I just think that is so critical for every aspect of your mental well-being, including your sexual well-being.
I mean, we're biased, but of course.
Of course.
Yeah. Well, thank you. This has been so insightful. What is the one thing maybe you want listeners to take away when they think about how they could be having better sex?
That you are entitled to pleasure in your life. That it is not a treat, not an extra, not that's something that you have to get lucky to have. Yeah. That pleasure is critical to your well-being, your mental health, your physical health, to your relationship, and that it's something that you deserve to have. And lead with curiosity.
I love that. Pleasure is a birthright. It's a human right.
Yeah.
Access to pleasure with another person is not an entitlement.
Exactly.
But pleasure in and of itself is something we should expect to fuel us.
And actively cultivate.
Yes, we are not passive participants in the pleasure journey.
Exactly.
Amazing. Well, thank you so much for joining me today. Where can folks find you if they want to learn more about your work?
Thank you.
I know you have a TED Talk. What else are you?
Yes, we'll definitely grab a copy of my book.
Yes.
You Could Be Having Better Sex. It's available at bookstores everywhere. And follow me on Instagram or TikTok at Nicole the Sex Professor. I have a lot of fun there. And then if you're interested in following my newsletter, you can sign up for that if you go to my website, NicoleTheSexProfessor.com.
Amazing. Thank you so much.
Thank you, Dr. Kate. This was fabulous.
This was so fun. Thanks, everyone, for listening. I'll catch you next time on Get Naked with Dr. Kate. That's our time today. Thank you for joining me and for showing up for yourself. Before we go, a gentle reminder. This podcast is for education and exploration. It's not a substitute for clinical care. If you're ready for more personalized support, my team and I at Modern Intimacy offer free consultations to help you figure out what that could look like. You can go to modernintimacy.com or find the link in the show notes. Until next time, keep getting smarter, getting closer, and getting naked in all the ways that matter to you.